already steals the show. Okay, fragility fracture. It just simply means you're having a fracture simply because what? That part of the body is so soft, it's so fragile. Okay, so fragility fracture, what we got here is this: is a fracture that occurs from a low energy trauma. So something that normally should not cause issues to you, you are having issues simply because your bones are so soft. Okay, so such as maybe you are falling from a standing height or less. So this normal height that was standing, somebody fell from here, but there was a fracture. Okay, so things that normally should have not caused a fracture in a healthy bone, they cause fractures in somebody that has this fragile syndrome. So causes minimal traumas like you slip, you trip, or minor impacts, they cause a lot of issues. Okay, so underlying issues, so reduced bone density and quality. All right, common sites occurs in the vertebrae, in the hip, in the wrist, in the humerus. So clinical significance is what? It indicates that there's an underlying issue. So you don't only look at the fractures. You don't only look at the fractures, but for somebody to have that kind of weak stuff, you know, it's actually an issue. So risk factors, it could be biological, it could be your age, it could be women that have gone past menstruation time, you know. Then it could be endocrine disorders. Okay, it could be lifestyle issues like you smoke, you take alcohol, poor nutrition. So diagnosis, you look at the clinical history. Okay, look at the imaging. Okay, so clinical history, are trying to look at what caused this fracture in these patients. You understand? Imaging, you do X-ray, CT scans, and MRI. Then you also do all those dual energy X-ray absorptiometry, just to look at the bone mineral density. So management, acute fractures, you do all those pain controls, immobilization, then all right, surgeries if needed, all those hip fracture stabilization. All right, so you treat any underlying bone health, like you give all those calcium and vitamin D supplements. Okay, then also anti-resorptive drugs, others biphosphonates and what, denosumab, anabolic agents, then lifestyle modifications, like you reduce the weight you are bearing there. If the person is obese, they should stop. If they take alcohol, they should stop. If they smoke, they should stop. So that's what we got for the fragility fractures.